The U.S. State Department is increasing its do not travel guidance this week to about 80% of countries worldwide. In a statement yesterday, the agency cited unprecedented risks to travelers amid the ongoing coronavirus pandemic. The State Department already lists 34 out of about 200 countries as level 4 do not travel. So for more on this, let's bring in Dr. Dyan Hes. She is the founder of Gramercy Pediatrics in New York City. Doctor, great to see you. Dr. Hes, in order to reach that 80%, it implies that the U.S. is adding nearly 130 countries to the list. What do you make of these new travel guidelines? We don't know the specifics yet, but we know it's going to be most of the world. And can you elaborate on what sort of unprecedented risks travelers are facing? Because level 4 is usually, what they say for, I don't know, like a country that's dealing with like a war or something, some sort of military action.
Destabilization.
Yeah, I think that
destabilization. There you go.
Right. I think that you have to think about this almost like biological warfare, right? So we don't want to bring something back to our country that is going to undermine our vaccine efforts. And I know right now in Israel, they're seeing some of the India strain, so they're testing it. I know that there have been several breakthrough cases of COVID in the United States, possibly and probably due to new variants. The problem is that let's say you had your 2 COVID vaccines and it's a 2 weeks period after, and you think that you're vaccinated. We are now seeing some breakthrough COVID cases, and that's why we recommend that people still mask, and that's hard for people to understand. And then it takes 2 to 3 weeks for that COVID case to get sequenced, and you have to request that it gets sequenced. So it's not just intuitive. So it's like when the lab gets a positive COVID case, they don't know if you had your COVID vaccine or not. So we're always behind the 8 ball, trying to catch up with science. So what we're trying to do is to prevent these new strains from entering the United States and from becoming, another wave of another pandemic here.
Yeah, I mean, I'm looking at the list right now, Dr. Hes and Anne-Marie, on the State Department website, and it's the usual suspects. Anne-Marie, you mentioned loving Paris and traveling to France when you can. France is level 3, reconsider travel. It's not level 4, but many of the countries that I'm looking at right here are level 3 and 4. And so, I guess the question, Dr. Hes, is when we think about travel, there's a lot of subtlety there, right? Are you going to one of these countries that's a level 4 country, but you're going to spend the majority of your time on a beach? That's different if you are going to a country where the majority of your time is going to be spent indoors at museums and at cafes and indoors at restaurants and, going to, social events. I mean, is that one way to gauge it? Or in your medical opinion, would you say if it's level 4, don't even risk it?
Well, if it's level 4, don't even risk it unless maybe you have a death in the family or something like that. But the other thing is, if they're level 4, I doubt their museums and cafes are going to be open. I think if it's level 4, then that country will probably be on another lockdown. I would hope. I have to tell you, I had a patient yesterday who just returned from Germany, and she said it's not like it is here. She said they were in a small town, people aren't really wearing masks, they're not taking it seriously. Even though everything is locked down, when you go outside to get your groceries, people were still not wearing masks. She said it was really a wake-up call. They had to go for a family emergency. So what the U.S. determined as significant improvements in wearing masks and safety to reopen might not be in other countries equivalent.
I gotta admire the way you asked that question, though, Vlad. It was just a touch leading. Doctor, if you're on the beach, I mean, it's not the same, right? Can you tell that both Vlad and I are really dying for like an away vacation?
Yeah.
That being said, Doctor, yesterday. That is true. That is true. Yesterday was the deadline for all states to open vaccine eligibility to everyone age 16 and older. What's your reaction to this, and what are you hearing from parents and teens in your practice?
My families are calling and saying, "Is it okay if we go? Is it okay if we go?" And people are actually misled. They think that you need a doctor's note to get a COVID vaccine, and you don't need a doctor's note. You don't need, if they're 16, you don't need a letter from your physician. You just need an ID, and you show up and you get your Pfizer vaccine. I think the hardest part for most of my patients is finding the Pfizer vaccine, because a lot of the pharmacies have Moderna. and Pfizer is more, in New York City at least, Pfizer is more at the state-run level, like at the Javits Center or the Aqueduct Racetrack. So not every pharmacy has the Pfizer, and if they do, they're using a lot of the Pfizer for the second dose. So it's just about booking that appointment and getting your Pfizer vaccine, and I'm highly encouraging it. We're going to see going down the pipe that most colleges are going to probably start requiring vaccination for kids to return to school. It's starting already, that they're sending out bulletins that we want you to have the COVID vaccine for college. It's not mandated for high school, but I can tell you just from my kids' high school that most kids, I have 2 teenagers, and most of my kids' friends who can get the vaccine are getting it.
The CDC doctor is also recommending that anyone who gets any other vaccine wait 14 days before getting a COVID shot. Explain why that is.
So that's not new. That was actually, I worked in the COVID vaccine center the first day it came out, the first week, and we've been saying that all along. And that's just because no studies were done giving a COVID vaccine with another vaccine. So we want to wait and make sure that, look what happened with Johnson & Johnson. This is how we are able to create a pause and to find out that there are side effects. Because if you went and got your COVID vaccine and then you went and got a tetanus booster because your grandchild's being born the next week, we wouldn't know if the side effect is from the tetanus booster or the COVID vaccine. So that's not new. It might have just made headlines now, but it's definitely not new information, and it's safe. Yesterday, I had a girl who was going to camp, 16 years old. She got her first Pfizer vaccine. Next dose is in 3 weeks. She needs her meningitis shot for camp. I said, let's not do it right now because we're in that 3-week window. You have time until camp. Go get your second Pfizer. Come back in June.
Dr. Dyan Hes, always great to have you. Thank you so much. We appreciate it.